Hi, it's Doug Holland, LMT, with another massage tip for massage professionals. Today we're going to be addressing leg spasms, or as my grandfather used to call them, Charley horses. Yeah, that's that severe spasming of the calf muscle that will drop the average person to the ground and make them do all kinds of weird contortions and make all kinds of noises. But on the sports field, when somebody has a leg spasm, well, they get the sports massage therapist to get in there and get to work. And as a general rule, they're going to address the most phasic muscle of the posterior leg, and that's going to be the gastrocnemius, because that's the explosive muscle. That's the muscle that gets worn out the quickest. But there is a postural muscle deeper than that that also could be the source of the serious leg cramps. And that's the one that we're going to talk about today, the soleus muscle. So between the gastrocnemius and the soleus muscle, that's usually the primary cause of these spasms. But how do we get deeper underneath that gastrocnemius? It's not easy. Well, first what we're going to do is we're going to go to this chart. And I'm going to show the origins, insertions, and actions of these two muscles and how I'm going to go up underneath them. And then we're going to go to the table, and then we're going to demonstrate on the patient how I like to get in there and address it. It's going to be a lot of fun. So let's go to the chart first and see what we can do. So here we're looking at the lower legs here. This is the thigh. This is the posterior aspect of the lower legs. And we can see what's represented here on the left leg is the superficial view of the gastrocnemius. Now, as you can see, it's a bipinnate muscle, meaning that it has a medial head and a lateral head, and then it's joined together by an aponeurosis that becomes a part of the calcaneal tendon, also known as the Achilles tendon. Now, the origin of this particular muscle is on the medial and lateral condyles of the femur. So it does cross the knee, so that means it can flex the leg itself. It can flex this lower foot up, and you can actually touch your heel bone to your buttocks there because of that. But below this muscle, this phasic muscle, this muscle that allows you to dunk a basketball, is the soleus muscle. So we see the cutout here. They've cut out where the gastrocnemius is, and you can see deeper to it is this postural muscle. Now, postural muscles have the ability to endure a whole lot longer. They have more red fibers in them. Whereas these phasic muscles are mostly made, like the gastrocnemius, of white fibers. So it's more explosive. So this is less explosive. And notice it does not cross the knee, so it does not flex the knee at all. It's simply a stabilization muscle. It's a planting muscle. So if you're stopping quickly in lateral movement, back and forth, anything like that, balancing yourself on a balancing beam, walking on the side of a hill, this is the muscle that's engaging in postural activity. And this muscle can cramp just as much as the gastrocnemius can. And so how do we get to that muscle? Here we got this large bellies of the gastrocnemius. They seem like, wow, they're right in in the way. But the reality is we can lift this muscle and we can get underneath it from the medial and lateral side to work the sides of the soleus muscle, or we can split right down the middle here, right here where that aponeurosis joins these two bellies. We can shove our fingers or knuckles through here and we can reach this tissue. And that's the best that we can do to get to it without actually dissecting and taking off the gastrocnemius itself. So again, just as a reminder, there's three muscles that make up the Achilles tendon. We have the plantaris, which is a very weak flexor of the knee, and it helps a little bit with plantar flexion. Then we have the gastrocnemius, that is the main, and then we have the soleus muscle underneath. Those three muscles are the ones that create the Achilles tendon. And I'll tell you what, when you get leg cramps in here, actually the spasms, if you get them in the gastrocnemius, can actually radiate up into the hamstrings themselves. People have felt them that way. But as a general rule, if we want to get deep down into these muscles, we want to get through them, it's going to be a little painful. Unfortunately, it's a little bit painful. But hey, if there's no discomfort, well, then it's nothing more than a foo-foo massage, right? Onto the table to work on a patient. Okay, so when addressing leg cramps, we're going to be looking at those two muscles. Here's the superficial one, the one closest to the skin, is the gastrocnemius that we discussed earlier. It's the bipennate muscle that converges down onto the calcaneal tendon. Below this muscle, deeper, is the soleus muscle. So here's how I like to work it. I like to take this muscle here, the gastrocnemius, and I lift it with my fingers. You're not going to want to have lotion on your hands when you're doing this. You're going to want to lift the muscle up, and then I'll take my fingers and I will cup up underneath, and I will dig in both sides, and I can actually feel the transition of that deep postural muscle, the soleus muscle. So I actually walk. It's a pinching motion as I go through. It's like a palpation, but you're actually digging in and pressing on it. So that's one way that I tackle it. The second way is I actually lift the gastrocnemius up like this, and then with lotion, I start stripping the muscle in between. So I lift and I strip. I lift and then I strip. So the bottom hand, the one that's a little bit deeper, is actually stripping the muscle that's below this superficial muscle on top. So that's another way I get in there and I hit it. And you can definitely tell the difference when it's worked on you. I was able to discover the difference of the feeling between the gastrocnemius being worked and the soleus muscle underneath. Now, another way to get to that muscle is find the two bellies of the gastrocnemius. Find the medial belly here or the lateral belly here, and then kind of palpate, and you'll feel that aponeurosis that's in between. Okay, you divide the line just like that, and then I will take my fingers, go straight in, and then I'll do circular friction. I'll dig straight in and I'll do circular friction. I'm able to get down in between those two bellies and hit that soleus muscle a little deeper that way. On a stronger person, it has a really strong gastrocnemius, you might have to use your knuckles like that. You might have to dig in like this, apply pressure with your wrist, and then go down in between. Okay? Now, a lot of this you don't want to use lotion on, but here's an example of where we will. So we have the stripping, we have then going in between like this. We can use our knuckles like that. But another way to get to it, because remember, this foot right now is just lightly plantar flex without any contraction of these muscles. We can actually take the foot, place the metatarsal heads right on your sternum, right on that xiphoid process of your sternum. Dorsiflex the foot like this. See, now I'm dorsiflexing it, which brings that gastrocnemius, it actually contracts it and brings it to the surface. And then I take, this is when I have lotion on my hands, I take my fingers and then I go through like this and I strip on the sides, right down the middle like this. And you can actually drive in, lift the gastrocnemius, and tuck in. Now that's when it gets really painful if you tuck in. I'm doing it really gently on her, but you can get way up underneath there and you can strike the soleus muscle that way. You can actually take your palms and squeeze in too. I've actually taken my knuckles and gone down the sides to try to reach it also. But you can do those kind of experiments. Again, if you take your fingers and you get in between those, there's going to be, of course, there's going to be a little bit of fascia in there that you're going to be stripping around. But lifting, stripping underneath like this, going through with a deep palpation, or dorsiflexing to bring that muscle up like we did from the sternum. These are the ways that I like to reach that. Now, if the person's really got tight legs, and especially if they got a real tight gastrocnemius, what I like to do is cross fiber friction using the forearm. So I'll actually go across and I'll raise the gastrocnemius up, and then I use my elbow to hit the soleus muscle that way. Cross fiber friction up, get in there, strike it, and then use your elbow to do a little bit of circular friction that way. Bring the gastrocnemius up, your elbow will hit that spot, and then you just go ahead and do a little circular friction. Man, I'm telling you something. I'm barely touching her and she's feeling it. This can be very, very painful. And of course, when you want to work the medial side, you do the complete opposite. You lift it up with your elbow, and then you go ahead and you drive. So you lift up that belly, that medial belly, and then you drive. They'll let you know. You can actually feel the difference between that superficial muscle being worked and that deeper postural muscle work. You can actually feel the difference. And you should have somebody do it on you, or you experiment on a friend and work it together so that you can really see the difference and helping them. So when you're working on athletes that have issues, a lot of times it's that deeper muscle. So if you enjoyed this particular video, please hit like and subscribe. You can go to our website at hollandreflexology.com, where we have all the articles that support what we do in our videos. And again, just remember this: if there's no discomfort, well, it's nothing more than a foo-foo massage.